Hi, everyone. My name is Gaba, and I'm a cardiology fellow at the Brigham and Women's Hospital in Boston. Today, I have the very unique opportunity and privilege of interviewing Dr. Deepak Bhatt from the the director of the Mount Sinai Heart Program, as well as the Valentin Fuster Professor of Medicine of Cardiovascular Medicine there. It is really an honor to have you here, Dr. Bhatt, and I'm really looking forward to hearing more about the late-breaking clinical trial you presented here at ACC, the HALO trial.
Well, it's great to be with you.
Thank you so much. All right, so perhaps the first question we could talk a little bit about is sort of what was the premise behind the HALO trial and how did you get involved with it?
So that's a terrific question. The HALO trial pertains to patients with uncontrolled hypertension. It's actually being run in parallel with the Brighton trial, which was recently published in New England Journal of Medicine. That was patients with resistant hypertension. Both phase 2 trials designed to see if a novel aldosterone synthase inhibitor called baxdrostat would be useful in those two different populations. Again, both were phase 2. The primary purpose was to assess safety, but of course we also looked at blood pressure lowering. And in Brighton, we found a significant reduction in blood pressure, about 11 millimeter mercury reduction in systolic blood pressure in the highest dosing arm of 2 milligrams a day. And the goal here was to see in a population not of resistant, but sort of slightly lower down the risk ladder, uncontrolled hypertension, what would happen as far as blood pressure control. But again, the primary purpose was safety.
Gotcha. That's very interesting. And I'm just curious, so in terms of the population that you looked at, who were the patients you were focusing on in this study in particular?
So these were patients with uncontrolled hypertension. The definition here was that they were essentially on one or two antihypertensive agents and still had blood pressure that was not, optimal. And we took such patients and randomized them to placebo or one of 3 different doses of baxdrostat, and overall showed that the drug was safe, the potential concerns being things like hyponatremia, hyperkalemia, hypotension, and there were some cases of elevated potassium, but all resolved either with drug interruption and reinitiation or drug cessation. And that sort of mirrors what we saw in the previous Brighton trial. So with the caveat of limited, modest sample sizes of phase 2 trials, we didn't see anything as far as really showstoppers in terms of side effects. In terms of efficacy in the HALO trial, unlike Brighton, we didn't see any significant reduction in blood pressure, but we did sort of, in a post hoc fashion, try to tease apart what happened. And I'm happy to go into that if you'd like.
Yeah, no, I'd be really curious because, as you said, if the drug is considered safe, it has this interesting mechanism of action. Efficacy would be something I'm sure people are very interested in. So I'd be curious to know your thoughts about the post hoc analyses.
Sure. So, first in terms of pre-specified analyses, we had a bunch of pre-specified analyses. And so anything I say should be taken with a grain of salt when you have multiple unadjusted subgroup analyses in the context of a modest phase 2 trial. But, we did find, first of all, I should say, we did a really good job in terms of diversity on the basis of sex, on the basis of race, on the basis of ethnicity. Well, at least on the basis of race in terms of black-white. Actually, there weren't a lot of Asian patients, but in terms of women, black patients, Hispanic patients actually really did quite well. About half the study was Hispanic patients, but interestingly, in that pre-specified subgroup, we didn't see a benefit in terms of blood pressure, but in the non-Hispanic patients, there actually was a significant benefit that was seen. But I think it would be a mistake to think that this had to do with ethnicity per se. Other studies, such as from MESA, have shown that Hispanic patients, if anything, might benefit more from this approach, not less. Mm-hmm. So I think what it really was an issue of adherence. And the reason I think that is in a post hoc analysis, we saw that patients who were adherent as by measured drug levels did have a significant reduction in blood pressure of about 8 millimeters of mercury. Interestingly, those patients that were documented as non-adherent by blood levels, more than 95% were saying that they actually did take the drug, and the pill counts that we do in research studies indicated that they would have taken their pills. That is, they come in with a little pill box, and there are no pills in it, so you assume that the medicine is taken and not just thrown away or thrown in the garbage or something, but, again, points to the challenges of adherence, even in closely monitored clinical studies.
Yeah. No, that's an excellent point, and congratulations on, such a generalizable study. I think that's, as you are well aware of, one of the issues in clinical trials. So
Yes.
awesome to see that issue has been addressed in this particular trial.
And the hope is to go on to phase 3 testing, of course, right? Because everything I said, maybe the post hoc observations are true, maybe they're not. I think they're true because they're based on measured blood levels. But obviously, these are phase 2 trials we're discussing. There needs to be, and there's planned, a large phase 3 trial in resistant hypertension.
Got it. For more videos like this, please follow us on Twitter at FitsOnTheGo. And to watch more videos like this online, please go to our YouTube channel and stream at YouTube/FitsOnTheGo.
I'll make sure to tune in.
Thank you.